Question 1. The audit findings indicate that the Antrim Drivers Test Center is considering a significant alteration to the practical test route to accommodate ongoing roadworks. Which of the following approaches best demonstrates a commitment to responsible impact assessment and regulatory compliance with the Department for Infrastructure (DFI) guidelines in Northern Ireland? Option A. Rely on the personal experience of senior examiners to determine the suitability of the new route without formal documentation or broader consultation. Option B. Conduct a comprehensive impact assessment, documenting potential effects on driver safety, examiner workload, and test integrity, and consult with driving instructor representatives before implementing any route changes. Option C. Perform a brief review of the proposed route changes, focusing only on the logistical ease of examiner navigation. Option D. Implement the new test route immediately to avoid disruption, assuming the roadworks will not significantly affect driver performance. Correct answer is B. Conduct a comprehensive impact assessment, documenting potential effects on driver safety, examiner workload, and test integrity, and consult with driving instructor representatives before implementing any route changes. Explanation. The audit findings indicate a potential lapse in the Antrim driver's test's adherence to its established impact assessment procedures. This scenario is professionally challenging because it requires the test center to balance the immediate need for operational efficiency with the long-term responsibility of ensuring the safety and competence of new drivers, as mandated by the Department for Infrastructure (DFI) in Northern Ireland. A failure to properly assess the impact of changes can lead to unintended consequences, such as a decline in driver standards or an increase in road accidents, which directly contravenes the DFI's objectives for road safety. The best approach involves a thorough and documented impact assessment that considers all potential consequences of the proposed changes on driver safety, examiner workload, and the overall integrity of the testing process. This includes consulting relevant stakeholders, such as driving instructors and examiner representatives, to gather diverse perspectives. This approach is correct because it aligns with the principles of good governance and regulatory compliance expected by the DFI. It ensures that any modifications to the test are evidence-based, risk-mitigated, and ultimately serve the public interest by promoting safe driving practices. The DFI's guidelines implicitly require a proactive and systematic approach to evaluating changes that affect public safety. An approach that bypasses a formal impact assessment to implement changes quickly is professionally unacceptable. This failure to conduct a proper assessment represents a disregard for established procedures and a potential violation of the DFI's expectations for due diligence. It prioritizes expediency over safety and competence, which is ethically unsound and could lead to a decline in the quality of drivers licensed in Antrim. Another unacceptable approach is to conduct a superficial impact assessment that only considers immediate operational benefits without exploring potential negative consequences for driver safety or examiner training. This demonstrates a lack of foresight and a failure to uphold the core mandate of the driver's test, which is to ensure competent and safe road users. It is a breach of professional responsibility to overlook potential risks that could compromise public safety. Finally, an approach that relies solely on anecdotal evidence or the opinions of a limited group of individuals without a structured assessment process is also professionally flawed. This lacks the objectivity and rigor required for a comprehensive impact assessment and can lead to biased decision-making. It fails to provide the robust justification needed to demonstrate compliance with the DFI's standards for ensuring driver competence. Professionals should adopt a decision-making framework that prioritizes a systematic, evidence-based, and risk-aware approach to any proposed changes. This involves clearly defining the scope of the impact assessment, identifying potential risks and benefits, consulting relevant stakeholders, documenting findings, and implementing mitigation strategies where necessary. This ensures that decisions are not only compliant with regulatory requirements, but also ethically sound and in the best interest of public safety. Question 2. Risk assessment procedures indicate that an applicant for a Class G2 driver's license in Ontario has requested to deviate from the predetermined test route to drive past their home. What is the most appropriate course of action for the examiner to take? Option A. Inform the applicant that their request cannot be accommodated and proceed with the test without further explanation, creating a potentially tense atmosphere. Option B. Immediately agree to the applicant's request to drive past their home to accommodate their preference, as long as it doesn't significantly extend the test duration. Option C. Reluctantly agree to the request but focus only on basic maneuvers, assuming the applicant is familiar with the area around their home. Option D. Politely explain that the test route is standardized and cannot be altered for personal requests, ensuring the applicant understands the necessity of adhering to the official testing protocol. The correct answer is D. Politely explain that the test route is standardized and cannot be altered for personal requests, ensuring the applicant understands the necessity of adhering to the official testing protocol. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a client's stated preference and the potential for that preference to lead to an unsafe driving outcome. The examiner must balance the need to assess the applicant's ability to follow instructions with the paramount responsibility of ensuring public safety on the roads of Ontario. This requires careful judgment to avoid compromising either the integrity of the test or the safety of the applicant and other road users. Correct approach analysis. The best professional practice involves politely but firmly explaining to the applicant that the test route is predetermined and designed to assess a comprehensive range of driving skills under various conditions, as mandated by the Ontario Ministry of Transportation's Driver Examination Program standards. The examiner must clearly communicate that deviating from the planned route for personal preference is not permissible during the test. This approach is correct because it upholds the standardized testing procedures designed to ensure all applicants are evaluated on the same criteria, promoting fairness and objectivity. It also prioritizes safety by ensuring the applicant is tested in environments representative of typical driving conditions and that the examiner maintains control over the assessment environment. Adhering to the ministry's guidelines is a regulatory requirement. Incorrect approach is analysis. One incorrect approach would be to immediately agree to the applicant's request to take a different route. This is professionally unacceptable because it undermines the standardized nature of the driving test, potentially exposing the applicant to situations they are not yet proficient in or omitting critical skills the examiner needs to assess. It also violates the Ontario Ministry of Transportation's guidelines for conducting driving tests, which specify approved routes and assessment criteria. Another incorrect approach would be to dismiss the applicant's request rudely or dismissively without explanation. While not agreeing to the request, this lacks professionalism and can create an adversarial testing environment, potentially agitating the applicant and negatively impacting their performance. It fails to educate the applicant on the testing process and the importance of standardized procedures. A third incorrect approach would be to reluctantly agree to the request, but then fail to adequately assess the applicant's skills on the altered route, perhaps by rushing through the assessment or overlooking critical observations. This is also professionally unacceptable, as it compromises the integrity of the test by not fulfilling the examiner's duty to conduct a thorough and objective evaluation according to the established standards. Professional reasoning. Professionals in this role should employ a decision-making framework that prioritizes adherence to regulatory standards and ethical obligations. This involves 1. Understanding and internalizing the specific testing protocols and guidelines of the relevant authority, in this case, the Ontario Ministry of Transportation. 2. Recognizing the dual responsibility of assessing competence and ensuring safety. 3. Communicating clearly and respectfully with the applicant, explaining the rationale behind testing procedures. 4. Maintaining professional composure and objectivity, even when faced with client requests that conflict with established protocols. 5. Prioritizing safety and fairness above all else. Question 3. Operational review demonstrates that a driving instructor in Antrim has a learner who is eager to book their practical driving test, stating they feel almost ready and want to get it done. The instructor has observed that while the learner has improved significantly, they still exhibit hesitation in complex junctions and occasionally misjudge speed on country roads, common challenges on routes around Antrim. Considering the standards set by the Driver and Vehicle Agency, DVA, for Northern Ireland, what is the most appropriate course of action for the instructor? Option A. Conduct a final mock test simulating DVA conditions, providing honest feedback on areas still requiring improvement, and only recommend booking the test once consistent competence is demonstrated. Option B. Advise the learner to book the test immediately, as their enthusiasm suggests they are motivated, and the experience of the test itself will be a valuable learning opportunity. Option C. Suggest the learner book the test and use the instructor's car, hoping the familiarity of the vehicle will compensate for any minor skill gaps. Option D. Recommend the learner book the test as soon as possible, explaining that the examiner will likely be lenient given the learner's perceived effort and desire to pass. Correct answer is A. Conduct a final mock test simulating DVA conditions, providing honest feedback on areas still requiring improvement, and only recommend booking the test once consistent competence is demonstrated. Explanation. Scenario analysis. This scenario presents a professional challenge for an Antrim driving instructor by requiring them to balance the immediate need to assess a learner's readiness for the test with the paramount responsibility of ensuring public safety on the roads of Northern Ireland. The instructor must navigate the learner's eagerness against objective safety standards and the legal requirements for obtaining a driving license in Northern Ireland. This requires careful judgment, an understanding of the Antrim driving test standards, and a commitment to ethical instruction. Correct approach analysis. The best professional practice involves a thorough, objective assessment of the learner's driving skills against the official standards for the Antrim driving test. This approach prioritizes safety and compliance with the Driver and Vehicle Agency (DVA) guidelines for Northern Ireland. The instructor must ensure the learner demonstrates consistent competence in all required areas, including hazard perception, vehicle control, and adherence to road traffic laws specific to Northern Ireland before recommending them for the test. This aligns with the ethical duty of care owed to the learner and the public, and the legal requirement to only present candidates who are likely to pass and drive safely. Incorrect approaches analysis. Recommending the learner for the test solely based on their expressed desire to book it, despite evident weaknesses, fails to uphold the instructor's duty of care and the DVA standards. This approach prioritizes customer satisfaction over public safety and the integrity of the licensing process. Allowing the learner to book the test with the hope they might get lucky is unprofessional and potentially dangerous, as it bypasses the necessary skill development and assessment. Suggesting the learner take the test just to see what it's like, without adequate preparation, is irresponsible. It wastes the learner's test fee, increases the likelihood of failure, and more importantly, could lead to unsafe driving practices being tested or even exhibited on public roads, potentially endangering themselves and others. This directly contravenes the DVA's mandate to ensure all licensed drivers are competent and safe. Professional reasoning. Professionals in this field should employ a structured decision-making process. First, they must clearly understand the specific requirements and standards of the relevant licensing authority, in this case, the DVA for Northern Ireland. Second, they should conduct objective, ongoing assessments of the learner's skills, identifying both strengths and areas needing improvement. Third, they must communicate these assessments transparently and constructively with the learner, setting realistic expectations. Finally, the decision to recommend a learner for a driving test should be based on a confident evaluation that the learner meets all competency and safety criteria, ensuring they are not only ready to pass, but also to drive safely and legally on the roads of Northern Ireland. Question 4. Strategic planning requires an examiner administering the Antrim driver's test to consider how to best support a candidate who repeatedly fails due to severe test day anxiety, while upholding the integrity and safety standards of the testing process. Which of the following represents the most professionally sound and regulatory compliant approach? Option A. Fail the candidate without further comment, as their nervousness is their personal issue and not the examiner's responsibility to address beyond the standard test outcome. Option B. Suggest to the candidate that they might consider practicing driving in a way that is less likely to trigger their anxiety during the test, even if it deviates from standard safe driving practices. Option C. Document the candidate's nervousness and its impact on their driving performance. Advise them to seek professional help to manage their anxiety and reiterate the objective criteria for passing the test. Option D. Pass the candidate despite their evident nervousness, significantly impairing their ability to drive safely, based on sympathy for their repeated failures. The correct answer is C. Document the candidate's nervousness and its impact on their driving performance. Advise them to seek professional help to manage their anxiety and reiterate the objective criteria for passing the test. Explanation. Strategic planning requires a thorough understanding of the regulatory landscape to ensure compliance and ethical conduct. In the context of the Antrim driver's test, a scenario involving a candidate who has repeatedly failed the practical test due to nervousness presents a professionally challenging situation. The challenge lies in balancing the need to uphold the integrity and standards of the driving test with the examiner's duty of care and the candidate's well-being. It is crucial to avoid compromising safety standards while also being sensitive to the candidate's psychological state. The best approach involves a structured and empathetic response that prioritizes safety and adherence to the Antrim driver's test regulation. This approach acknowledges the candidate's difficulties, offers appropriate support within the scope of the examiner's role, and clearly outlines the path forward based on established testing criteria. Specifically, it involves documenting the candidate's nervousness and its impact on their performance, advising them to seek professional help to manage their anxiety, and reiterating the objective criteria for passing the test. This aligns with the principles of fair assessment and the examiner's responsibility to ensure all drivers meet the required safety standards for operating a vehicle on public roads in Antrim. The examiner must remain impartial and focus on the observable driving performance against the set standards, while also offering constructive guidance that does not undermine the testing process. An incorrect approach would be to pass the candidate despite their evident nervousness, significantly impairing their ability to drive safely, based on sympathy or a desire to conclude the testing process. This would violate the core principle of the Antrim driver's test, which is to ensure public safety by only licensing competent drivers. Such an action would disregard the regulatory requirement to assess driving skills objectively against established safety benchmarks and could lead to dangerous situations on the road. Another incorrect approach would be to dismiss the candidate's nervousness entirely and simply fail them without offering any constructive feedback or suggestions for improvement beyond the standard test report. While adhering to the testing criteria is paramount, a professional examiner should also aim to guide candidates towards success where possible, within ethical and regulatory boundaries. Failing to acknowledge the impact of nervousness and offer appropriate advice, such as suggesting they seek support for anxiety, misses an opportunity to assist the candidate in overcoming their barrier to passing the test legitimately. Finally, an incorrect approach would be to suggest that the candidate deliberately alter their driving style to trick the testing system, or to imply that the test is inherently unfair due to their anxiety. This undermines the integrity of the Antrim driver's test and is ethically unsound. The focus must always be on assessing the candidate's ability to drive safely and competently according to the established standards, not on manipulating the process. Professionals should employ a decision-making framework that begins with a clear understanding of the relevant regulations and ethical guidelines. This involves objectively assessing the situation against these standards, considering the impact on all stakeholders, candidate, public safety, and then choosing the course of action that best upholds both compliance and professional integrity. In this case, it means prioritizing safety and fair assessment while offering appropriate, non-compromising support. Question 5. During a practical driving assessment in Antrim, an examiner observes a candidate exhibiting nervousness that leads to a minor hesitation at a junction, causing a brief delay for other traffic. The candidate is otherwise competent in all other assessed areas of the Antrim driver's test syllabus. Considering the paramount importance of public safety and the established assessment criteria, which of the following actions best reflects professional and regulatory compliance? Option A. Fail the candidate immediately due to the hesitation at the junction, as any delay to traffic is unacceptable under Antrim's road safety guidelines. Option B. Allow the candidate to repeat the junction maneuver immediately, providing coaching until they execute it perfectly before continuing the assessment. Option C. Pass the candidate, acknowledging their overall competence and assuming they will gain confidence and improve their junction handling with further experience on Antrim's roads. Option D. Conduct the assessment to its conclusion, objectively scoring the candidate's performance against all criteria of the Antrim driver's test syllabus, and make a pass or fail decision based solely on whether the required standard of safe driving competence has been demonstrated. The correct answer is D. Conduct the assessment to its conclusion, objectively scoring the candidate's performance against all criteria of the Antrim driver's test syllabus, and make a pass or fail decision based solely on whether the required standard of safe driving competence has been demonstrated. Explanation: the assessment process reveals a scenario that is professionally challenging due to the inherent conflict between a candidate's perceived readiness and the objective safety standards mandated by the Antrim driver's test regulations. The examiner must balance empathy with a strict adherence to the law, ensuring that no compromise is made on public safety, which is the paramount concern of the licensing authority in Antrim. The correct approach involves a thorough, objective assessment based solely on the established criteria of the Antrim driver's test syllabus. This approach prioritizes safety and fairness by ensuring all candidates are evaluated against the same, legally defined standards. The examiner's role is to observe and record performance against these criteria, making a decision based on whether the candidate meets the required level of competence to operate a vehicle safely on Antrim's roads. This aligns directly with the regulatory framework governing driver licensing in Antrim, which emphasizes the examiner's duty to uphold public safety through rigorous and impartial testing. Ethical considerations also demand impartiality, preventing personal feelings or external pressures from influencing the assessment outcome. An incorrect approach would be to allow personal judgment or sympathy to override the objective assessment criteria. For instance, if an examiner were to pass a candidate who demonstrated a clear deficiency in a critical skill, such as hazard perception or correct lane discipline, based on the belief that the candidate almost had it or would learn with experience, this would be a direct contravention of the Antrim driver's test regulations. Such a decision would not only be ethically unsound by compromising public safety, but would also undermine the integrity of the licensing system. Similarly, allowing a candidate to reattempt a specific maneuver multiple times beyond what is permitted by the test protocol, or accepting a verbal assurance of future improvement in lieu of demonstrated competence, would fail to meet the required standards and expose other road users to unnecessary risk. These actions demonstrate a failure to apply the established assessment framework consistently and objectively. Professionals in this role should employ a decision-making framework that begins with a clear understanding of the governing regulations and syllabus. This framework requires objective observation, meticulous recording of performance against defined criteria, and a commitment to making decisions based solely on that evidence. When faced with a borderline case, the professional should refer back to the specific requirements of the Antrim driver's test syllabus and err on the side of caution if safety standards are not unequivocally met. The focus must always be on the candidate's demonstrated ability to drive safely, not on their potential or perceived effort. Question 6. The evaluation methodology shows that a driver's ability to react to unexpected situations is a key component of safe driving. During a practical driving test in Antrim, a candidate, while approaching a moderately busy junction, hesitates for a noticeable moment before proceeding, despite clear visibility and no immediate hazards. Considering the Antrim driver testing regulations, what is the most appropriate course of action for the examiner? Option A. Continue the test as normal, assuming the hesitation was a minor lapse and the candidate will recover their composure. Option B. Ask the candidate to explain their hesitation before deciding whether to continue or postpone the test. Option C. Pause the test, assess the candidate's reaction and the junction conditions, and if there is any doubt about the candidate's ability to safely control the vehicle, postpone the test. Option D. Immediately fail the candidate for demonstrating a lack of confidence and decisiveness at a junction. The correct answer is C. Pause the test, assess the candidate's reaction and the junction conditions, and if there is any doubt about the candidate's ability to safely control the vehicle, postpone the test. Explanation: the evaluation methodology shows that assessing a driver's ability to navigate complex road conditions is paramount for licensing. This scenario is professionally challenging because it requires the examiner to balance the need for a thorough assessment with the safety of the applicant and the public, while adhering strictly to the Antrim driver testing regulations. The examiner must make a judgment call on whether to proceed with a test that presents an immediate, albeit minor, safety concern, or to postpone it. The best approach involves prioritizing safety and adherence to established procedures. This means recognizing that even a minor deviation from expected vehicle control, such as a slight hesitation at a junction, could indicate a latent issue that might be exacerbated by more demanding conditions. Therefore, the examiner should pause the test, assess the situation, and if there's any doubt about the applicant's ability to safely control the vehicle under current or anticipated conditions, postpone the test. This aligns with the Antrim driver testing regulations' emphasis on ensuring all licensed drivers possess a minimum standard of competence and safety, as outlined in their guidelines for assessing hazard perception and vehicle control. Postponing the test in such a situation is not a failure, but a responsible application of the regulations to prevent potential risks. An incorrect approach would be to proceed with the test despite the hesitation, assuming it was a minor lapse. This fails to uphold the rigorous safety standards mandated by the Antrim driver testing regulations, which require a consistent demonstration of safe driving. Another incorrect approach would be to immediately fail the applicant without further observation or consideration of the context. While safety is paramount, a single, minor hesitation might not automatically warrant a fail if it was a momentary lapse and the applicant quickly recovered. However, the initial hesitation itself necessitates a pause for assessment, making immediate continuation or immediate failure without due consideration problematic. Professionals should employ a decision-making framework that begins with identifying potential risks. This involves observing the applicant's performance against the established criteria of the Antrim driver testing regulations. If any observed behavior raises concerns about safety or competence, the next step is to pause and assess the severity and potential implications of that behavior. Based on this assessment, the examiner then decides whether to continue the test, postpone it, or fail the applicant, always referencing the specific requirements and spirit of the Antrim driver testing regulations. Question 7. Analysis of a driver's recent diagnosis of a condition that could potentially affect their reaction time and visual acuity in Ontario, Canada. What is the most appropriate course of action regarding their ongoing driver's license application process? Option A. Proactively disclose the medical condition to the Ontario Ministry of Transportation and follow their established procedures for medical review and assessment. Option B. Rely on the advice of their driving instructor and only disclose the condition if specifically asked during the practical driving test. Option C. Inform family members about the diagnosis and wait for them to suggest whether or not to report it to the authorities. Option D. Assume the condition is not severe enough to impact driving ability and proceed with the license application without mentioning it. The correct answer is A. Proactively disclose the medical condition to the Ontario Ministry of Transportation and follow their established procedures for medical review and assessment. Explanation. Scenario analysis. This scenario presents a professional challenge for a driver applying for a license in Ontario, Canada, due to a recent medical diagnosis. The challenge lies in balancing the applicant's desire to drive with the paramount responsibility of public safety. Ontario's Ministry of Transportation, MTO, regulations, specifically the Highway Traffic Act and associated medical standards, mandate that individuals must be medically fit to drive. Failure to disclose relevant medical information or to comply with MTO requirements can have serious legal and ethical consequences, including potential accidents and liability. Careful judgment is required to ensure compliance with the law, while also considering the individual's circumstances. Correct approach analysis. The best professional practice involves the driver proactively and truthfully disclosing their medical condition to the Ontario Ministry of Transportation and following the prescribed process for medical review. This approach aligns directly with the requirements of the Ontario Highway Traffic Act, which obligates drivers to report any medical condition that may impair their ability to drive safely. The MTO then has a clear framework, guided by medical advisory committees and established standards, to assess the driver's fitness. This ensures that decisions are made based on objective medical evidence and public safety considerations, rather than on assumptions or incomplete information. This proactive disclosure protects the driver from potential penalties and ensures that any driving restrictions or requirements are properly implemented. Incorrect approaches analysis. One incorrect approach is for the driver to simply not mention their condition, hoping it goes unnoticed. This is a direct violation of the Ontario Highway Traffic Act's disclosure requirements. It creates a significant risk to public safety by allowing an individual who may be medically unfit to operate a vehicle without proper assessment. Ethically, it is a breach of trust and demonstrates a disregard for the safety of other road users. Another incorrect approach is for the driver to only inform their driving instructor but not the MTO. While the instructor can offer advice, they are not the regulatory body responsible for licensing and medical fitness assessments in Ontario. This approach fails to meet the legal obligation to report to the MTO and bypasses the necessary medical review process, leaving public safety compromised. A third incorrect approach is for the driver to assume their condition is not serious enough to affect their driving and therefore not report it. Medical conditions can have subtle or progressive impacts on driving ability. The MTO's medical standards are designed to assess these potential impacts objectively. Relying on personal assessment rather than the official regulatory process is a failure to comply with the law and puts others at risk. Professional reasoning. Professionals in situations involving licensing and medical fitness must prioritize regulatory compliance and public safety. The decision-making process should involve 1. Identifying the relevant regulatory framework. In this case, Ontario's Highway Traffic Act and MTO medical standards. 2. Understanding the legal obligations of the individual and the responsibilities of the regulatory body. 3. Assessing the potential risks to public safety. 4. Choosing the approach that ensures full transparency and adherence to established procedures for medical assessment and licensing. When in doubt, always err on the side of caution and full disclosure to the relevant authorities. Question 8. The review process indicates that an applicant for a driver's license in Ontario, Canada, has disclosed a history of epilepsy. Considering Ontario's regulatory framework for driver licensing and public safety, which of the following actions best represents the appropriate professional response? Option A. Grant the driver's license immediately, assuming the applicant's statement that their epilepsy is under control is sufficient. Option B. Deny the driver's license application outright upon learning of the epilepsy diagnosis, without further medical review. Option C. Rely solely on the applicant's physician to make the final decision regarding the applicant's fitness to drive, without independent review by the Ministry of Transportation, Ontario. Option D. Obtain a comprehensive medical report from the applicant's physician detailing seizure history, treatment, and the physician's professional opinion on driving fitness, and then assess this report against the Ministry of Transportation, Ontario's medical standards for drivers. The correct answer is D. Obtain a comprehensive medical report from the applicant's physician detailing seizure history, treatment, and the physician's professional opinion on driving fitness, and then assess this report against the Ministry of Transportation, Ontario's medical standards for drivers. Explanation. The review process indicates a scenario where an applicant for a driver's license in Ontario, Canada, has disclosed a history of epilepsy. This situation presents a professional challenge due to the inherent conflict between facilitating an individual's right to obtain a driver's license and the paramount responsibility of ensuring public safety on Ontario's roads. The Ministry of Transportation, Ontario, MTO, has specific regulations and guidelines governing medical conditions that may impair driving ability, and adherence to these is critical. Careful judgment is required to balance the applicant's needs with public safety imperatives. The correct approach involves a thorough and objective assessment of the applicant's medical condition, in accordance with Ontario's Highway Traffic Act and the MTO's medical standards for drivers. This includes obtaining a detailed medical report from the applicant's physician, specifically addressing seizure frequency, control, and any potential impact on driving. The physician's assessment must be evaluated against the MTO's established criteria for medical fitness to drive. If the medical evidence suggests that the applicant's condition, even with treatment, poses a significant risk to themselves or others, the MTO has the authority to refuse or suspend a license or impose specific conditions. This approach is correct because it directly aligns with the MTO's mandate to ensure that only medically fit individuals operate vehicles, thereby upholding public safety as mandated by Ontario law. It prioritizes evidence-based decision-making and adherence to established medical guidelines. An incorrect approach would be to grant the license solely based on the applicant's assertion that their condition is under control, without independent medical verification. This fails to meet the regulatory requirement for objective assessment and places undue reliance on the applicant's subjective statement, potentially compromising public safety. Another incorrect approach would be to immediately deny the license upon learning of the epilepsy diagnosis without a proper medical review. This would be an arbitrary decision, failing to consider the nuances of the condition, treatment efficacy, and the specific medical standards set by the MTO, potentially violating the applicant's right to a fair assessment. A further incorrect approach would be to delegate the decision-making entirely to the applicant's physician without the MTO's own review process, as the MTO retains the ultimate authority and responsibility for licensing decisions based on its specific safety standards. Professional reasoning in such situations requires a systematic process. First, identify the relevant regulatory framework, Ontario's Highway Traffic Act and MTO medical guidelines. Second, gather all necessary information, prioritizing objective medical evidence. Third, apply the established criteria to the gathered evidence. Fourth, make a decision that is consistent with both legal requirements and ethical obligations to public safety. Finally, communicate the decision and any required next steps clearly to the applicant. Question 9. Performance analysis shows that a client in London, UK, is insistent on investing in a high-risk, speculative product that does not align with their stated financial goals of capital preservation and moderate growth. As a financial advisor regulated by the FCA, what is the most appropriate course of action? Option A. Conduct a thorough discussion with the client, clearly outlining the risks and potential downsides of the speculative product, explaining why it conflicts with their stated goals, and documenting this conversation and the client's informed consent if they still wish to proceed against advice, or guiding them towards more suitable alternatives. Option B. Refuse to discuss or consider any investment that deviates from the advisor's initial, conservative recommendations, regardless of the client's expressed interest. Option C. Immediately invest in the speculative product as requested by the client to maintain client satisfaction and avoid potential conflict. Option D. Proceed with the speculative investment without any further discussion or documentation, assuming the client understands the inherent risks. Correct answer is A. Conduct a thorough discussion with the client, clearly outlining the risks and potential downsides of the speculative product, explaining why it conflicts with their stated goals, and documenting this conversation and the client's informed consent if they still wish to proceed against advice, or guiding them towards more suitable alternatives. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a client's stated preference and the advisor's fiduciary duty to act in the client's best interest, particularly when the client's preference may lead to suboptimal outcomes or increased risk. The advisor must navigate this by prioritizing regulatory compliance and ethical obligations over immediate client satisfaction, requiring careful judgment and clear communication. Correct approach analysis. The approach that represents best professional practice involves a thorough, documented discussion with the client about the risks and benefits of their preferred investment strategy, clearly outlining why it may not align with their stated financial goals or risk tolerance. This includes providing alternative, suitable recommendations that meet regulatory requirements and ethical standards. The advisor must then obtain informed consent from the client, acknowledging their understanding of the risks and their decision to proceed against advice, or guide them towards a more appropriate strategy. This aligns with the principles of client suitability and the advisor's duty of care, as mandated by the Financial Conduct Authority, FCA, in the UK, which requires advisors to understand their client's knowledge and experience, financial situation, and objectives to ensure recommendations are appropriate. Incorrect approach is analysis. Recommending the client's preferred investment without a detailed risk assessment and discussion fails to uphold the advisor's fiduciary duty and suitability obligations under FCA regulations. This approach prioritizes client preference over client well-being, potentially exposing the client to undue risk or unsuitable products. Proceeding with the client's request solely based on their insistence, without adequate documentation of the risks, and the client's informed consent to proceed against advice, leaves the advisor vulnerable to regulatory scrutiny and potential complaints. Another incorrect approach involves dismissing the client's preference outright and refusing to consider any investment that deviates from the advisor's initial recommendations. While the advisor has a duty to recommend suitable investments, an overly rigid stance can damage the client relationship and may not fully explore the client's underlying motivations or potential for understanding more suitable options. This can be seen as a failure to engage in a constructive dialogue and explore all avenues to meet the client's needs within regulatory boundaries. Finally, agreeing to the client's preferred investment without any discussion of its suitability or risks, and without documenting the conversation, constitutes a severe breach of regulatory and ethical standards. This demonstrates a lack of diligence and a failure to act in the client's best interest, potentially leading to significant harm to the client and disciplinary action against the advisor. Professional reasoning. Professionals should employ a structured decision-making process that begins with a comprehensive understanding of the client's objectives, risk tolerance, and financial situation. When a client expresses a preference that appears misaligned, the professional's first step is to engage in open and honest dialogue, explaining the rationale behind their recommendations and clearly articulating the potential downsides of the client's preferred course of action. This dialogue should be thoroughly documented. If the client remains insistent, the professional must ensure the client fully understands the risks and provides informed consent to proceed, or guide the client towards a compromise that balances their preferences with regulatory and ethical requirements. The ultimate goal is to ensure the client's financial well-being is protected while respecting their autonomy within the bounds of regulatory compliance. Question 10. Operational review demonstrates that an Antrim driving instructor has recorded the fuel consumption for 2 recent driving lessons. The first lesson covered 400 km and consumed 50 liters of fuel. The second lesson covered 380 km and consumed 45 liters of fuel. What is the average fuel consumption in liters per 100 kilometers, L/100 km, for these 2 lessons combined? And which calculation method best represents this average? Option A. Calculate the total distance traveled divided by the total fuel consumed. Option B. Round the individual fuel consumption figures to the nearest whole number before calculating the average. Option C. Calculate the average of the individual fuel consumption figures for each lesson without weighting by distance. Option D. Calculate the total fuel consumed and divide by the total distance traveled, then multiply by 100. This yields approximately 18 L/100 km. The correct answer is D. Calculate the total fuel consumed and divide by the total distance traveled, then multiply by 100. This yields approximately 18 L/100 km. Explanation. Scenario analysis. This scenario presents a professional challenge for an Antrim driving instructor by requiring them to accurately calculate the fuel efficiency of a vehicle under varying conditions, which directly impacts the advice given to a learner driver regarding fuel conservation. Miscalculation could lead to misleading advice, potentially affecting the learner's understanding of economical driving practices and their ability to pass a practical driving test that may assess such awareness. The challenge lies in applying mathematical principles to real-world driving data and adhering to the specific standards expected in Northern Ireland. Correct approach analysis. The best approach involves accurately calculating the average fuel consumption in liters per 100 kilometers, L/100 km, using the provided data. This is achieved by summing the total fuel consumed and dividing it by the total distance traveled, then multiplying by 100. This method directly addresses the core of fuel efficiency measurement and aligns with common industry standards for reporting. The calculation is as follows. Total fuel consumed equals 50 liters plus 45 liters equals 95 liters. Total distance traveled equals 400 km plus 380 km equals 780 km. Average fuel consumption equals \frac 95 text liter 780 text km times 100 average fuel consumption approx 18 text L/100 km This precise calculation provides a quantifiable measure of the vehicle's performance, enabling the instructor to offer informed advice on fuel-efficient driving techniques relevant to the Antrim test routes. Incorrect approaches analysis. One incorrect approach would be to simply average the 2 individual fuel consumption figures without considering the distance driven for each. This would be calculated as \frac 50 text liters 400 text km times 100 plus \frac 45 text liters 380 text km times 100 2 approx \frac 12 5 text L/100 km plus 11 84 text L/100 km 2 approx 12 17 L/text L/100 km/. While this yields a close result in this specific instance, it is mathematically unsound as it gives equal weight to shorter and longer journeys, failing to accurately represent the overall fuel efficiency. This approach is ethically questionable as it provides a potentially inaccurate representation of the vehicle's performance. Another incorrect approach would be to calculate the fuel consumption in miles per gallon, mpg, and then attempt to convert it, or to only consider the total distance and total fuel without the correct formula. For instance, calculating total distance divided by total fuel, frac 780 text km95 text liters approx 8, 21 text km/liter. This metric, while related to fuel efficiency, is not the standard L/100 km expected for reporting and comparison in many contexts, including potentially within the Antrim driving test syllabus's implied understanding of vehicle operation. Providing advice based on a non-standard metric could confuse the learner. A further incorrect approach would be to round the individual fuel consumption figures significantly before averaging, or to use an approximation that lacks precision. For example, rounding 5 L/100 km and 84 L/100 km to 13 L/100 km and 12 L/100 km respectively, and then averaging, frac 13 text L/100 km plus 12 text L/100 km2 equals 12. 5 text L/100 km. This level of inaccuracy, stemming from premature rounding, leads to a misleading figure and demonstrates a lack of diligence in mathematical application, which is unprofessional. Professional reasoning. Professionals should always prioritize accuracy and adherence to established standards. When faced with calculations, the first step is to identify the required metric and the most appropriate formula. In this case, L/100 km is the standard, and a weighted average based on distance is essential for accuracy. Professionals should then perform the calculation meticulously, double-checking their work. If unsure about the required standard or formula, they should consult relevant guidelines or resources, such as the DVSA, Driver and Vehicle Standards Agency, materials pertaining to vehicle knowledge for driving instructors in Northern Ireland. This ensures that advice given to learners is accurate, professional, and contributes to their overall understanding of safe and economical driving. Question 11. Investigation of how an Antrim driver's test examiner should respond when a nervous candidate expresses significant anxiety about a specific maneuver, fearing they will fail due to their nervousness rather than a lack of skill. Option A. Immediately skip the maneuver and move to the next section of the test to reduce the candidate's stress. Option B. Calmly reassure the candidate, explain the purpose and requirements of the maneuver clearly, and proceed with the test while maintaining objective observation. Option C. Agree with the candidate that their nervousness is a valid reason for potential failure and offer to reschedule the test. Option D. Express personal understanding of their anxiety and suggest they might perform better if the test were conducted on a different day under less pressure. The correct answer is B. Calmly reassure the candidate, explain the purpose and requirements of the maneuver clearly, and proceed with the test while maintaining objective observation. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a client's expressed wishes and the potential for harm or misjudgment. The Antrim driver's test framework emphasizes safety and competence, requiring examiners to make objective assessments. The challenge lies in balancing client rapport and understanding with the examiner's duty to uphold testing standards and public safety, especially when a client's perception of their own ability may be impaired. Careful judgment is required to ensure the test is conducted fairly and safely, without succumbing to undue influence or misinterpreting genuine anxiety. Correct approach analysis. The best professional practice involves a calm, objective, and empathetic approach. This means acknowledging the client's anxiety and reassuring them about the process and their rights, while firmly but politely reiterating the necessity of adhering to the test's requirements and safety protocols. The examiner should clearly explain the purpose of each maneuver and the criteria for success, ensuring the client understands what is expected. This approach aligns with the Antrim driver's test's core principles of fair assessment and public safety. It demonstrates professionalism by managing the client's emotional state constructively without compromising the integrity of the test. Ethical considerations of fairness and duty of care are met by ensuring the client has a clear understanding of the test and that the assessment is conducted objectively. Incorrect approaches analysis. One incorrect approach involves dismissing the client's concerns outright and proceeding with the test without addressing their anxiety. This fails to acknowledge the client's emotional state, potentially exacerbating their nervousness and leading to a less accurate assessment of their driving ability. It also breaches the ethical principle of treating individuals with respect and consideration. Another incorrect approach is to excessively modify the test to accommodate the client's anxiety, such as skipping essential maneuvers or lowering the standard for success. This directly violates the Antrim driver's test regulations, which mandate specific assessment criteria to ensure all drivers meet a minimum standard of competence and safety. Such a deviation compromises the integrity of the testing process and poses a risk to public safety. A further incorrect approach is to become overly sympathetic and allow personal feelings to influence the objective assessment. While empathy is important, allowing it to override professional judgment can lead to biased evaluations. This could result in passing a candidate who is not truly ready, thereby failing in the examiner's duty of care to the public. Professional reasoning. Professionals should adopt a decision-making framework that prioritizes objective assessment and adherence to regulatory standards, while also incorporating effective communication and client management skills. This involves 1. Active listening to understand the client's concerns. 2. Empathetic acknowledgement of their feelings without compromising professional objectivity. 3. Clear and concise communication of test requirements and expectations. 4. Firm adherence to established testing protocols and safety standards. 5. Objective evaluation based solely on demonstrated driving ability and adherence to rules. Question 12. Comparative studies suggest that during the Antrim driver's test in Ontario, an applicant's ability to safely navigate intersections is paramount. Considering the Ontario Highway Traffic Act, which of the following approaches best demonstrates an applicant's readiness to operate a vehicle in accordance with provincial law and safe driving practices? Option A. Assuming the meaning of signs based on their general appearance and common usage, and proceeding when it seems appropriate. Option B. Meticulously observing and correctly interpreting all traffic signs and signals encountered, and acting in strict accordance with their directives. Option C. Prioritizing speed and completing the test efficiently over careful observation and adherence to all traffic control devices. Option D. Reacting to the actions of other vehicles to determine how to proceed at intersections, rather than solely relying on posted signs and signals. The correct answer is B. Meticulously observing and correctly interpreting all traffic signs and signals encountered, and acting in strict accordance with their directives. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a driver to demonstrate not only their ability to operate a vehicle safely, but also their understanding of specific road rules and signage within Ontario. Examiner must balance the need to assess competence with the safety of the public and the applicant. Misinterpreting a sign or failing to yield appropriately can have immediate and serious consequences, highlighting the critical nature of accurate observation and adherence to traffic laws. Correct approach analysis. The best professional practice involves the applicant meticulously observing and correctly interpreting all traffic signs and signals encountered during the Antrim driver's test. This approach is correct because it directly aligns with the Ontario Highway Traffic Act, which mandates that all drivers must obey traffic control signs and signals. Specifically, the applicant must demonstrate an understanding of signs like the stop sign, which requires a complete cessation of movement before proceeding when safe, and yield signs, which require giving way to other traffic. Failure to do so constitutes a direct contravention of traffic law and demonstrates a lack of preparedness for safe driving. Incorrect approach is analysis. One incorrect approach is to assume the meaning of a sign based on its general appearance or common usage, without confirming its specific designation and required action according to Ontario traffic regulations. This is ethically and regulatorily unsound, as it relies on guesswork rather than established law, potentially leading to dangerous situations and violations. Another incorrect approach is to prioritize speed and completing the test quickly over careful observation and adherence to all traffic control devices. This demonstrates a fundamental misunderstanding of safe driving principles, which emphasize caution and compliance, not haste. Such an approach would violate the spirit and letter of the Highway Traffic Act, which prioritizes safety above all else. A further incorrect approach involves reacting to other vehicles' actions rather than strictly adhering to the posted signs and signals. While situational awareness is important, primary directive during the test is to follow the established rules of the road as indicated by official signage. Relying on the behavior of others to dictate one's own actions is a recipe for disaster and a clear failure to demonstrate independent, rule-based driving competence. Professional reasoning. Professionals should approach this situation by prioritizing a thorough understanding and application of the Ontario Highway Traffic Act and its associated regulations. This involves a systematic approach to observation, where every sign and signal is identified, interpreted according to its legal meaning, and acted upon accordingly. Decision-making should be guided by a commitment to safety and compliance, recognizing that the Antrim driver's test is a formal assessment of one's ability to operate a vehicle legally and safely within the province. Question 13. The investigation demonstrates that during a driving test in Antrim, Mr. Henderson hesitated for several seconds at a junction after the traffic lights turned green, causing a minor disruption to following traffic. Ms. Davies, the examiner, must decide how to assess this incident. Which of the following represents the most appropriate professional response? Option A. Document the hesitation, assess its impact on traffic flow, and grade it according to the driver and vehicle agency's official marking criteria for driving faults, considering potential implications for safe and efficient driving. Option B. Immediately fail Mr. Henderson for the test due to the disruption caused, regardless of other aspects of his driving. Option C. Ignore the hesitation as no immediate hazard or accident occurred, focusing only on critical safety breaches. Option D. Classify the hesitation as a minor inconvenience and record it as a minor fault without further consideration of its potential implications for assertive driving. The correct answer is A. Document the hesitation, assess its impact on traffic flow, and grade it according to the driver and vehicle agency's official marking criteria for driving faults, considering potential implications for safe and efficient driving. Explanation. The investigation demonstrates a scenario where a driver, Mr. Henderson, is undergoing his Antrim driving test. The examiner, Ms. Davies, has observed a critical maneuver where Mr. Henderson hesitated significantly before proceeding at a junction controlled by traffic lights that had just turned green. This hesitation, while not causing an immediate hazard, did lead to a brief delay and a minor disruption to the flow of traffic behind him. The professional challenge here lies in the examiner's duty to accurately assess the driver's competence according to the standards set by the Driver and Vehicle Agency, DVA, in Northern Ireland. Balancing safety considerations with the practicalities of real-world driving. The examiner must determine if this hesitation constitutes a driving fault, and if so, what severity, without being overly punitive or lenient. The best approach involves the examiner meticulously documenting the observed behavior and its immediate consequences. This includes noting the specific junction, the traffic light status, the duration and nature of the hesitation, and the impact on other road users. The examiner should then assess this against the DVA's official marking criteria for the driving test. A significant hesitation at a junction, even if the lights have just turned green, can indicate a lack of confidence or an inability to anticipate traffic flow, which are key elements of safe driving. If the DVA guidelines classify such a hesitation as a driving fault, Ms. Davies must record it as such, assigning the appropriate fault grade minor, serious, or dangerous. This approach ensures objectivity, adherence to regulatory standards, and a fair assessment of the candidate's ability to drive safely and competently. An incorrect approach would be for the examiner to dismiss the hesitation entirely because no immediate danger was created. This fails to acknowledge that the driving test assesses not just the avoidance of accidents, but also the ability to drive assertively and efficiently, which are components of safe driving. The DVA's criteria often include faults related to indecision or lack of progress. Another incorrect approach would be to immediately fail the candidate for this single incident, without considering the overall context of the test or the specific severity of the hesitation as defined by the DVA. This could be an overreaction and not in line with the progressive fault system. Finally, an examiner incorrectly marking the hesitation as a minor fault when the DVA guidelines suggest it warrants a more serious grading would also be a failure of professional duty, as it would misrepresent the candidate's actual driving standard. Professionals should employ a decision-making framework that prioritizes adherence to established regulatory guidelines and ethical principles. This involves 1. Observation and documentation, accurately recording all relevant details of the observed behavior. 2. Regulatory application, consulting and applying the specific criteria and fault grading system of the relevant authority, in this case, the DVA. 3. Objective assessment, evaluating the behavior against the criteria without personal bias or emotional influence. 4. Justification, being able to clearly articulate the reasoning behind the assessment, referencing the specific rules and guidelines. Question 14. In Ontario, Canada, a driving instructor is evaluating a learner driver who has completed their required in-car training hours. The learner expresses strong confidence in their abilities and is eager to book their G2 road test, stating they feel ready. However, the instructor has observed consistent minor errors in the learner's observation skills during lane changes and occasional hesitation in merging with traffic. Considering the Ontario Ministry of Transportation's requirements for safe and competent driving, which of the following approaches best reflects professional and ethical responsibility? Option A. Proceed with recommending the student for the G2 road test, acknowledging the observed minor errors but believing that with practice during the test itself, the student will improve sufficiently. Option B. Focus on teaching the student specific techniques to navigate the common routes used for G2 testing in their area, emphasizing how to impress the examiner rather than on broader safe driving principles. Option C. Recommend the student for the G2 road test based on their expressed confidence and the completion of training hours, assuming the examiner will identify and address any significant deficiencies. Option D. Conduct a final comprehensive mock road test simulating the official G2 test conditions, objectively assessing all required maneuvers against MTO standards, and only recommend the student for the test if they consistently demonstrate proficiency and safe decision-making. The correct answer is D. Conduct a final comprehensive mock road test simulating the official G2 test conditions, objectively assessing all required maneuvers against MTO standards, and only recommend the student for the test if they consistently demonstrate proficiency and safe decision-making. Explanation. Scenario analysis. This scenario presents a professional challenge for a driving instructor in Ontario, Canada, concerning the assessment of a learner driver's readiness for the G2 road test. The challenge lies in balancing the learner's perceived eagerness and the instructor's professional obligation to ensure public safety and adherence to the Ontario Ministry of Transportation's MTO testing standards. A driving instructor must exercise sound judgment, relying on objective assessment rather than subjective feelings or external pressures, to determine if a student has met the required competencies for independent driving. Correct approach analysis. The best professional approach involves a comprehensive, objective evaluation of the learner's performance against the official MTO G2 road test criteria. This means systematically observing and documenting the learner's ability to execute all required driving maneuvers, obey traffic laws, and demonstrate safe driving habits in various road conditions. The instructor must consider the learner's consistency in performing these tasks, their ability to anticipate hazards, and their overall decision-making process while driving. This approach is correct because it directly aligns with the MTO's mandate to ensure that only competent drivers are licensed, thereby protecting public safety. It adheres to the ethical responsibility of the instructor to provide an honest and accurate assessment, preventing the student from undertaking the test before they are truly ready, which could lead to failure, potential accidents, and a compromised licensing process. Incorrect approach is analysis. One incorrect approach is to proceed with recommending the student for the G2 test based solely on the student's expressed confidence and the instructor's desire to please the student or conclude the training period. This fails to uphold the instructor's duty of care and professional integrity. It bypasses the critical step of objective assessment against established standards, potentially putting the student and other road users at risk. Ethically, it is a disservice to the student, as it may lead to a failed test and a false sense of preparedness. Another incorrect approach is to focus primarily on the student's ability to pass the test by teaching them specific tricks or shortcuts to navigate the testing routes or examiner expectations, rather than on developing robust, safe driving skills applicable to all situations. This approach undermines the purpose of the road test, which is to assess genuine driving competence and safety, not just the ability to perform a set routine. It is ethically questionable as it misrepresents the student's actual skill level and fails to equip them with the necessary defensive driving techniques. A further incorrect approach is to recommend the student for the test despite significant and recurring errors in fundamental driving skills, such as lane changes, speed control, or hazard perception, simply because the student has shown marginal improvement. This approach ignores the MTO's safety standards and the instructor's responsibility to ensure a minimum level of proficiency. It prioritizes expediency over safety and competence, which is contrary to the core principles of driver education and licensing. Professional reasoning. Professionals in this field should adopt a decision-making framework that prioritizes objective assessment and adherence to regulatory standards. This involves 1. Clearly understanding and internalizing the specific criteria outlined in the MTO's G2 road test requirements. 2. Conducting regular, documented evaluations of the learner's performance across all required competencies. 3. Providing constructive, specific feedback to the learner, highlighting areas of strength and weakness. 4. Making a recommendation for the road test only when the learner consistently demonstrates proficiency in all assessed areas, meeting or exceeding the MTO's standards. 5. Maintaining professional integrity by communicating honestly with the learner about their readiness, even if it means delaying their test date. Question 15. Compliance review shows that during a practical driving assessment in Antrim, an examiner instructs the candidate to turn left into a street that is clearly marked with a no entry sign. What is the most appropriate response for the candidate to demonstrate their understanding of road safety and regulatory compliance? Option A. Politely question the instruction by stating, "Examiner, that street is marked as no entry. Should I proceed?" Option B. Stop the vehicle abruptly and wait for further instructions without explanation. Option C. Argue with the examiner that the instruction is incorrect and refuse to turn. Option D. Immediately turn left as instructed, assuming the examiner knows best. The correct answer is A. Politely question the instruction by stating, "Examiner, that street is marked as no entry. Should I proceed?" Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the Antrim driver to balance the immediate need to complete the test with the paramount importance of road safety and adherence to the specific regulations of Northern Ireland. The examiner's role is to assess competence, not to create hazardous situations. The driver must demonstrate sound judgment and a commitment to safe driving practices, even when faced with an unexpected or potentially confusing instruction. Correct approach analysis. The best professional practice involves the driver acknowledging the examiner's instruction, but prioritizing safety and regulatory compliance. This means the driver should verbally confirm their understanding of the instruction, and if it appears unsafe or contrary to the rules of the road in Northern Ireland, politely question it or request clarification. For example, if instructed to turn left into a one-way street that is clearly marked as no entry or one-way traffic flow in the opposite direction, the driver should state, "Examiner, that street is marked as one-way traffic flowing the other way. Should I proceed?" This approach demonstrates critical thinking, adherence to traffic laws, e.g., the Highway Code Northern Ireland, and a commitment to safe driving, which are all core objectives of the Antrim driver's test. It allows the examiner to correct a potential misunderstanding or error in their instruction without compromising safety. Incorrect approaches analysis. One incorrect approach is to blindly follow the examiner's instruction, even if it is clearly unsafe or illegal. This demonstrates a lack of independent judgment and a failure to prioritize road safety, which is a fundamental ethical and regulatory requirement for all drivers in Northern Ireland. It suggests the driver is not capable of making safe decisions when faced with ambiguous or incorrect directions. Another incorrect approach is to panic and stop the vehicle abruptly without explanation. While stopping might be a safety measure, doing so without communicating with the examiner can be interpreted as a loss of control or an inability to handle a situation, which is not conducive to passing a driving test. It fails to demonstrate the ability to communicate effectively with other road users, including the examiner. A third incorrect approach is to argue with the examiner or refuse to follow instructions without a clear, safety-based justification. While questioning an unsafe instruction is appropriate, an aggressive or uncooperative attitude is unprofessional and indicates a lack of the temperament required for safe driving. This can be seen as a failure to demonstrate the necessary composure and respect for the testing process. Professional reasoning. Professionals in any testing scenario, including driving tests, must employ a decision-making process that prioritizes safety, regulatory compliance, and clear communication. When faced with an instruction that seems questionable, the professional should first assess the immediate safety implications. If safety is compromised, the next step is to seek clarification or politely point out the discrepancy, referencing relevant rules or signs. This demonstrates competence, responsibility, and the ability to think critically under pressure, all of which are essential for safe and lawful operation on public roads in Northern Ireland. Question 16. Regulatory review indicates that an individual in Ontario, Canada, has recently been diagnosed with a medical condition that may affect their ability to drive safely and is now taking prescribed medication. What is the most appropriate course of action for this individual and their physician regarding their Ontario driver's license application? Option A. The individual should not disclose their medical condition and medication to their physician to avoid any potential issues with their driver's license application. Option B. The individual should inform their physician but instruct them not to report the condition to the Ministry of Transportation, Ontario, as it is a private medical matter. Option C. The individual should fully disclose their medical condition and prescribed medication to their physician, who will then assess their fitness to drive and report to the Ministry of Transportation, Ontario if necessary. Option D. The individual should proceed with their driver's license application without consulting a physician, relying on their own judgment of their driving capabilities. The correct answer is C. The individual should fully disclose their medical condition and prescribed medication to their physician, who will then assess their fitness to drive and report to the Ministry of Transportation, Ontario if necessary. Explanation. Scenario analysis. This scenario presents a professional challenge for a driver applying for a license in Ontario, Canada, due to a recent medical diagnosis. The challenge lies in balancing the applicant's desire to obtain a license with the paramount responsibility of ensuring public safety on Ontario's roads. The Ministry of Transportation, Ontario, MTO, has strict regulations regarding medical fitness to drive, and a failure to disclose or accurately report relevant medical information can have severe consequences. Careful judgment is required to navigate the reporting obligations while respecting the applicant's privacy and rights. Correct approach analysis. The best professional practice involves the driver proactively and accurately disclosing their medical condition and any prescribed medication to their physician. This physician, in turn, has a legal and ethical obligation under Ontario's Highway Traffic Act and related MTO guidelines to assess the driver's fitness to operate a vehicle safely. If the physician determines the condition or medication may impair driving ability, they must report this to the MTO's medical review section. This approach ensures that the MTO receives timely and accurate information to make an informed decision about the driver's licensing status, thereby upholding public safety without unfairly penalizing the applicant before a proper assessment. Incorrect approaches analysis. One incorrect approach is for the driver to withhold information about their medical condition and medication from their physician, hoping to pass the driving test. This is a direct violation of the Highway Traffic Act's disclosure requirements and poses a significant risk to public safety. It also undermines the integrity of the licensing process. Another incorrect approach is for the driver to inform their physician but instruct them not to report the condition to the MTO, believing it is a private medical matter. While medical information is generally private, the Highway Traffic Act mandates reporting when a condition may affect driving safety. This approach disregards the legal obligation to protect the public. A third incorrect approach is for the driver to attempt to obtain a license without consulting a physician about their new medical condition, relying solely on their own assessment of their ability to drive. This bypasses the essential medical evaluation required by the MTO and demonstrates a lack of understanding of the regulatory framework designed to ensure road safety. Professional reasoning. Professionals in this situation should follow a decision-making process that prioritizes regulatory compliance and public safety. This involves 1. Understanding the specific reporting obligations under Ontario's Highway Traffic Act and MTO guidelines concerning medical fitness to drive. 2. Encouraging open and honest communication between the applicant and their physician regarding medical conditions and their potential impact on driving. 3. Ensuring that the physician conducts a thorough assessment and fulfills their reporting duties to the MTO if required. 4. Recognizing that the MTO is the ultimate authority in determining licensing eligibility based on medical fitness. Question 17. Consider a scenario where, during a driving lesson in Antrim, a learner driver discloses a recent diagnosis of a medical condition that could potentially affect their ability to drive safely. As a registered approved driving instructor, ADDI, in Northern Ireland, what is the most appropriate and legally compliant course of action? Option A. Proceed with the driving test as scheduled, with the understanding that the learner can inform the DVA about their condition after passing. Option B. Suggest the learner keep the diagnosis confidential from the DVA unless they feel significantly unwell on the day of their driving test. Option C. Offer your professional opinion on whether the medical condition is likely to impair their driving ability and advise them accordingly. Option D. Advise the learner that they must immediately inform the Driver and Vehicle Agency, DVA, in Northern Ireland about their diagnosed medical condition, as this is a legal requirement for assessing fitness to drive. The correct answer is D. Advise the learner that they must immediately inform the Driver and Vehicle Agency, DVA, in Northern Ireland about their diagnosed medical condition, as this is a legal requirement for assessing fitness to drive. Explanation. Scenario analysis. This scenario presents a professional challenge for an Antrim driving instructor regarding the ethical and regulatory implications of a learner driver's medical condition. The instructor must balance the learner's desire to pass their test with the paramount responsibility of ensuring road safety for the learner, other road users, and the public. Failure to adhere to the legal requirements for reporting medical conditions can lead to severe consequences, including potential prosecution and a detrimental impact on public trust in the driving instruction profession. Careful judgment is required to navigate the learner's emotional state and the instructor's professional obligations. Correct approach analysis. The correct approach involves immediately advising the learner that they must inform the Driver and Vehicle Agency, DVA, in Northern Ireland about their diagnosed medical condition. This aligns with the legal obligations stipulated by the Road Traffic, Northern Ireland, Order 1981, and associated regulations. The DVA is the statutory body responsible for assessing an individual's fitness to drive, considering their medical condition. The instructor's role is to facilitate the learner's compliance with these regulations, not to make a medical judgment or to allow the test to proceed if there is a known risk. This approach prioritizes public safety and regulatory compliance above all else. Incorrect approach is analysis. Advising the learner to withhold information from the DVA is a direct contravention of the Road Traffic, Northern Ireland, Order 1981. This approach creates a significant risk to public safety by allowing an individual with a potentially impairing medical condition to drive without proper assessment. It also exposes both the learner and the instructor to legal penalties. Suggesting the learner only inform the DVA if they feel significantly unwell on the day of the test is also a failure of regulatory compliance. The obligation to report a diagnosed medical condition is not contingent on the severity of symptoms on a particular day, but on the condition itself and its potential impact on driving ability. This approach is reactive rather than proactive and fails to meet the spirit and letter of the law. Proceeding with the test while knowing about the medical condition, with the intention of the learner informing the DVA later, is highly irresponsible and unethical. This places other road users at immediate risk. The instructor is complicit in potentially allowing an unfit driver onto the road, undermining the integrity of the driving test system and the DVA's mandate. Professional reasoning. Professionals in this situation should follow a clear decision-making framework. 1. Identify the core professional obligation, road safety and regulatory compliance. 2. Recognize the limitations of professional expertise. Driving instructors are not medical professionals and cannot diagnose or assess the impact of medical conditions on driving ability. 3. Consult relevant regulations. Understand the specific legal requirements in Northern Ireland regarding medical conditions and driving. 4. Prioritize safety and legality. Any action taken must ensure the safety of all road users and adhere strictly to the law. 5. Communicate clearly and ethically. Inform the learner of their obligations and the instructor's responsibilities without judgment, but with firm adherence to professional standards. 6. Document all interactions and decisions. Maintain records of advice given and actions taken. Question 18. Upon reviewing a client's portfolio in Ontario An investment advisor notes that the client, who has a low risk tolerance and limited investment experience, is requesting to invest a significant portion of their savings into a highly speculative and illiquid private equity fund. What is the most appropriate course of action for the advisor to take? Option A. Proceed with the investment as requested by the client, but provide a brief verbal warning about the potential for losses. Option B. Politely decline the client's request, stating that the advisor cannot facilitate such a high-risk investment for them. Option C. Engage in a detailed discussion with the client to understand their rationale for this specific investment, explain the risks and illiquidity associated with the fund, and assess if it truly aligns with their stated risk tolerance and financial goals before proceeding or refusing. Option D. Immediately execute the client's requested investment to respect their autonomy and avoid potential client dissatisfaction. The correct answer is C. Engage in a detailed discussion with the client to understand their rationale for this specific investment, explain the risks and illiquidity associated with the fund, and assess if it truly aligns with their stated risk tolerance and financial goals before proceeding or refusing. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential conflict between a client's stated wishes and the advisor's professional judgment regarding the suitability of a particular investment. The advisor must navigate the regulatory obligation to act in the client's best interest while respecting client autonomy, all within the specific framework of Ontario securities law. The challenge lies in identifying the precise point at which a client's instruction becomes a directive that the advisor must follow, versus a request that requires further professional guidance and potential refusal if it contravenes regulatory duties. Correct approach analysis. The best professional practice involves a thorough assessment of the client's stated investment objective and a detailed discussion to confirm understanding and suitability. This approach prioritizes the advisor's fiduciary duty under Ontario securities law, specifically the requirement to ensure that any recommended investment is suitable for the client based on their financial situation, investment objectives, risk tolerance, and knowledge. By engaging in a detailed conversation, the advisor can ascertain if the client truly understands the implications of investing in a high-risk, illiquid product, and if it aligns with their overall financial plan. If, after this discussion, the advisor still believes the investment is unsuitable, they have a regulatory obligation to refuse the order and explain their reasoning. As mandated by the Ontario Securities Commission, OSC, rules regarding suitability and client best interest. Incorrect approaches analysis. One incorrect approach involves immediately executing the client's instruction without further inquiry. This fails to meet the advisor's regulatory obligation to assess suitability. The advisor would be prioritizing the client's directive over their duty to ensure the investment is appropriate for the client's circumstances, potentially exposing the client to undue risk and violating OSC regulations. Another incorrect approach is to dismiss the client's request outright without attempting to understand their rationale or educate them on the risks. While the advisor may believe the investment is unsuitable, a complete refusal without dialogue can damage the client relationship and may not fully address the client's underlying financial needs or goals, which might be achievable through other, more suitable means. This approach also risks overlooking a genuine, albeit perhaps poorly articulated, client need. A third incorrect approach is to proceed with the investment, but to downplay the associated risks to appease the client. This is a serious ethical and regulatory breach. Misrepresenting the nature of an investment, even with the intention of satisfying the client, constitutes a failure to provide accurate information and violates the advisor's duty of care and honesty, as well as specific OSC disclosure requirements. Professional reasoning. Professionals should adopt a client-centric approach that balances client autonomy with regulatory obligations. The decision-making process should involve 1. Active listening to understand the client's request and underlying motivations. 2. A thorough assessment of the client's profile, financial situation, objectives, risk tolerance, knowledge. 3. Clear and transparent communication about the suitability of any proposed investment, including potential risks and benefits. 4. If an investment is deemed unsuitable, a professional refusal with a clear explanation, and offering alternative, suitable solutions. This framework ensures compliance with regulatory requirements and upholds ethical standards. Question 19. When evaluating a complex unsignaled junction in Antrim, What is the most appropriate course of action for a learner driver to demonstrate compliance with the Antrim Road Traffic Regulations 1997? Option A. Proceed into the junction cautiously, assuming that other drivers will yield to allow passage. Option B. Actively observe all traffic signs, road markings, and other road users, and apply the established hierarchy of right-of-way as dictated by the Antrim Road Traffic Regulations 1997. Option C. Hesitate significantly at the junction, waiting for a clear and extended gap in traffic before proceeding, even if right-of-way is technically established. Option D. Rely on general driving experience and common sense to navigate the junction, as specific Antrim regulations may be overly complex for a test scenario. The correct answer is B. Actively observe all traffic signs, road markings, and other road users, and apply the established hierarchy of right-of-way as dictated by the Antrim Road Traffic Regulations 1997. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the driver to interpret and apply complex traffic regulations in real time, under pressure, and with potential safety implications. The driver must not only understand the rules, but also exercise sound judgment when faced with ambiguous or rapidly changing situations. The Antrim driver test specifically assesses this ability to ensure road safety. Correct approach analysis. The best approach involves the driver demonstrating a thorough understanding of the Antrim Road Traffic Regulations 1997, specifically focusing on the rules governing right-of-way at junctions. This means actively observing all signs, road markings, and other road users, and then applying the established hierarchy of right-of-way, e.g., traffic lights, stop signs, give way signs, and the general rule of giving way to traffic from the right when no other signs are present. This approach is correct because it directly aligns with the primary objective of the Antrim driving test, to ensure drivers can operate vehicles safely and legally on Northern Ireland's roads by adhering to its specific legal framework. The regulations are designed to prevent collisions and ensure predictable traffic flow. Incorrect approaches analysis. Proceeding without clear right-of-way, assuming other drivers will yield, is a failure to comply with the Antrim Road Traffic Regulations 1997. This demonstrates a lack of adherence to established rules and an over-reliance on the actions of others, which is unsafe and unacceptable in a driving test. Hesitating excessively and blocking traffic flow, even when right-of-way is clear, also demonstrates a lack of competence. While caution is important, prolonged indecision can create hazardous situations and indicates an inability to navigate junctions efficiently as per the spirit of the regulations. Interpreting the situation based on general driving experience from other regions, rather than strictly adhering to the Antrim Road Traffic Regulations 1997, is a critical failure. Each jurisdiction has its own nuances, and the test is specifically designed to evaluate knowledge of local laws. Professional reasoning. Professionals should approach such situations by prioritizing a deep understanding of the specific legal framework governing their operations. This involves continuous learning and application of relevant regulations. When faced with ambiguity, the decision-making process should involve 1. Identifying the relevant regulations. 2. Assessing the situation against those regulations. 3. Choosing the safest and most compliant course of action. And 4. Being prepared to justify the decision based on the regulatory framework. Question 20. The analysis reveals that a driving school in Ontario, Canada, is conducting its annual fleet-wide tire inspection for its fleet of 15 training vehicles. Each vehicle has 4 tires. The recorded tread depths in millimeters for a sample of 10 tires from different vehicles are 4, 5, 5, 2, 3, 8, 6, 1, 4, 9, 5, 5, 3, 1, 4, 2, 5, 8, and 4, 7. If the minimum legal tread depth for tires in Ontario is 1.6 mm, and the school aims to maintain an average tread depth across all tires in its fleet that is at least 2.0 mm greater than the legal minimum, what is the minimum average tread depth the school must aim for across its entire fleet of 60 tires? Option A, 3.6 mm. Option B, 2.0 mm. Option C, 5.6 mm. Option D, 1.6 mm. The correct answer is A, 3.6 mm. Explanation. The analysis reveals a scenario where a driving instructor in Ontario, Canada, must ensure their business operations comply with provincial regulations regarding vehicle safety and operational standards, specifically concerning the maintenance of a fleet of training vehicles. This is professionally challenging because it requires a proactive approach to safety, balancing operational efficiency with the absolute necessity of adhering to legal requirements to protect both students and the public. Failure to do so can result in significant penalties, reputational damage, and most importantly, compromise safety. The best professional approach involves meticulously tracking and documenting all maintenance activities for each training vehicle, ensuring they meet or exceed the standards set by the Ontario Highway Traffic Act and associated regulations. This includes maintaining a detailed log of all inspections, repairs, and servicing, with specific attention to tire tread depth, brake system functionality, and lighting. This proactive and documented approach directly aligns with the regulatory obligation to operate vehicles in a safe and roadworthy condition, thereby minimizing risk and demonstrating due diligence. The calculation of the average remaining tread depth across the fleet, as demonstrated in Option A, is a critical metric for assessing the overall safety and compliance of the vehicles. For instance, if the minimum legal tread depth for tires in Ontario is 1.6 mm, and the average across the fleet falls below this, it immediately flags a compliance issue requiring immediate attention. The formula for average tread depth would be //text average tread depth equals /frac /sum I equals 1n /text tread depth in where n is the number of tires inspected and /text tread depth I is the tread depth of the I/th tire. An incorrect approach would be to rely solely on visual inspections without systematic record keeping. While a visual check might identify obvious issues, it lacks the quantitative data necessary to demonstrate compliance or to identify gradual wear that could lead to a safety hazard. This approach fails to meet the regulatory requirement for demonstrable maintenance and safety checks. Another incorrect approach would be to only address maintenance issues when a vehicle fails an inspection or when a student reports a problem. This reactive strategy is inherently risky, as it implies that vehicles might be operating in a non-compliant state for extended periods. It also fails to proactively manage the fleet's safety and can lead to unexpected breakdowns or accidents, which are direct violations of the duty of care and regulatory expectations. A further incorrect approach would be to prioritize cost saving by deferring non-critical maintenance until it becomes a significant problem. While financial prudence is important, it cannot supersede the legal and ethical obligation to maintain vehicles in a safe operating condition. This approach directly contravenes the spirit and letter of the law, which mandates that vehicles must be roadworthy at all times. The professional decision-making process for such situations should involve establishing a robust preventative maintenance schedule based on manufacturer recommendations and regulatory requirements. This schedule should be supported by a comprehensive record-keeping system that allows for regular review of vehicle condition and compliance metrics. When faced with data, such as the average tread depth calculation, professionals must interpret it against the legal minimums and act decisively to rectify any deficiencies, prioritizing safety and compliance above all else.